if it's possible to have my speech with the microphone. Thank you very much, Professor Arzu Urban, for inviting me. Really a very, very big event. And what is better, put all together the integrative and complementary medicine. That is really a very, very good compliment. And I am happy to be here, just because this is what I want to say. And just want to start to tell you what I am. Lamberto is a medical doctor like you, and for 40 years I was a pharmacologist. So a medical doctor working in the science, so if you want to call science. But I was surprised by the failure of this, because medicine and any other things can work alone. We need something more. And many years ago, when I was in Cuba, one professor told me, "Hi, Lamberto, you are working as physiologist in the neurophysiology. Why you don't try to use ozone?" And really, at the beginning, I was impressed. How could it be possible that ozone, that is a strong oxidant, could be helpful? But in the same time, we had a lot of problems that we can't solve with our medicine. So we know that in this context, in the last years, there are a lot of elderly people. Most of them are suffering of pain, most of them. And I mean, in the Western countries, more developed Western countries, the expenses for this problem is about million of dollars. And if you want to ask to one of these old men or women, "How are you? Are you happy?" No. Most of them tell, "No, I am suffering." So how could it be possible that we spend a lot of money and so far we have very beautiful medicine, very beautiful new anti-inflammatory, but so far we are not happy, not satisfied. What does it mean? That we must open our eyes. And that time, I opened my eyes. I don't know if it's true or not, but some people, some colleagues called me crazy at that time. Now I suppose that they change this idea. Because what we need now is something to integrate, to complement, to reach the well-being of the suffering people. So I can accept any criticism before that some people do not open the eyes and look, okay, could be useful or not. So this is what I am trying to do, and if I was convinced, I want to try to convince you, because you must be proud to be here as medical doctors, because that means that you want to know more to help your people that is so far suffering. So you must be proud to be here. And what this slide is my slide that I use since a long time. But what better than this to explain that to reach the well-being, we can't think that alone with our science or with our medicine we can reach the target. We need more of this. Just you never ask to your patient, which kind of medicine I can give to you, or what is your lifestyle? So instead of give medicine, please ask for the lifestyle. What is your food? And after, okay, if we can't intervene, we can give some integrative approach that we must always take in our mind, that we must give to our patient less problem than the illness. Sometimes we give some medicine that can worsen the situation of the patient. So what better that this Congress, where we have homeopathy, we have musical therapy, we have aromatherapy, we have everything, and ozone therapy too, all to integrate, all together, just in the aim to help suffering people. Never forget this. The suffering people could be one of your family. And most of the doctors forget this sometimes, most of our colleagues. We must have in our mind that we are giving something to our relatives, my son, my wife. And the best for them must be the best for all the people that is in your clinic. So, really, sometimes when we mean we born with a gene and this gene give us the illness, it's not true. The gene alone do not express if your lifestyle is different. I remember always the two twins, homozygotes twins at 50 years, one with diabetes and the other one no diabetes. How could it be possible? The genes are the same, but one expressed it and one no. Why? Because the lifestyle of one of these was so bad that diabetes, the gene, produced the effect. So, what does mean this? What we are? We are the results of our genes and our behavior. That could give us well-being or illness. I want to tell this because we have now the evidence that ozone therapy could be very helpful in this field. But okay, I don't want to go. When I received the first message about ozone, they told me, you give a small oxidative stress and you have back an antioxidant response. Could be possible. I wondered. Because in the literature you can find a lot of examples. If you give ischemia to one kidney, brief ischemia, you give a signal to their kidney, and if the ischemia at the end is strong, the kidney is protected by the ischemia. Does mean that some biochemical pathways produce a defenses against the same stimulus. So, what is ozone therapy really? Ozone is not a drug. Like Professor Adriana told before, ozone is oxidative stress. And you must always take into account exactly that the level of the antioxidant capability is different from all the people. Not only from elderly and also in the same age. So this is the difficult to give ozone at the exact concentration to promote a response and not to give a damage. And we can see how many pathological illnesses are due to the unbalancement of the oxidative stress. So now we can better understand if this is the real mechanism, the adaptive mechanism of ozone. We can understand why in our clinic we can see so different positive results in pain, in the age, in the aesthetic. You can see women doing autohemotherapy just because the skin is better. It's wonderful. The hair grow, the pain go. How could it be possible that there is this heterogeneous network of illnesses? Probably because there is a common way, biochemical pathway. So here we can see that at that time when I started 26 years ago, I gave a look to the website, only two papers talking about ozone in therapy, and 1,000 papers talking about ozone for pollution. So the idea, so you are a crazy doctor if you are going to do ozone therapy, but you are crazy. You know that ozone is bad. please use our medicine that is not so toxic. I want to reverse this concept. Give a look, open your mind. What is the good ozone and the bad ozone? The good ozone is the low-level ozone that our nature produces in the morning. You go to pray in the morning, they told me in Dubai, because the Prophet told in the morning, very earlier, the rise sun, the oxygen flow from the tree, and the prayer will save your soul, and one gas will save your body. I don't know if it's true. Let me know where you read, but you can imagine that is the good ozone. How ozone it forms from oxygen? After a storm, so high electricity transform a small amount of oxygen in ozone. That's the good ozone, non-toxic. But if you breathe, I feel good. And the other one in the morning is also the good. What is the bad ozone? Is the ozone that produces the man. With car, a lot of car in small city. So the problem is that ozone is toxic. The man is crazy. Our population, we are destroying everything, also the good things. So we want to discover this and tell that it's not the substance that gives the problem. So now we can find a lot of papers. Okay, we are going toward less crazy. But just because I was a pharmacologist, I want to know, how could it be possible? If I give to you, for example, it's very simple. No, I remember, if I want to give, to send to a journal, very big journal, neuroscience, just some data regarding acetylcholine or a beta blockers, I can give you the measure of heart rate. So most of them will be the medium 75. I give you propranolol, and after I measure the heart rate, after propranolol, all of you go down because I block the muscarinic receptors. And this is a good result by a scientific point of view, because I can demonstrate that an anti-muscarinic substance can reduce the heart rate. So for ozone, it's not so easy. If I put ozone in your body, there is receptors, like the muscarinic receptors. No. How can I do to evaluate the mechanism, the results? So you can see the difference. On the left is that what we study in our medical faculty, in the pharmacology course, they told when you increase the drugs, you increase the effect. In the case of a hormetic stress, so one stress that is strong, you have no effect at low doses, good effects so it's a bell, inverted bell, and the toxicity at higher doses. This is a new model, but does not mean that does not work. We only take into account that this model is different from the pharmacological model, Micheli's mental reaction, for example. So, some years ago, reading some papers about this James Watson, the first. James Watson was the Nobelist who discovered the DNA. He told, I want to give you an unconventional explanation of diabetes. Metabolic disorders, we don't have metabolic disorders because we have oxidative stress. But we have diabetes because there is a loss of oxidative stress. And he told, why? Exercise. Usually, when you do exercise, you increase your oxidative stress. And we know that the exercise reduces the damage of diabetes. So the relationship, when I found these papers on The Lancet is a very big journal, I was surprised. So it's the lack of oxidative stress that gives the problem, not the excess. And Iverson, in the molecular aspects of medicine, defines the oxidative stress as the consequence of a gene imbalance. So he explained it. The hypothesis is that there is oxidative stress excess when our genes, coming back to my first slide, when genes come back to work not well and express some bad things. But to know if really there is a genetic plasticity, an upregulation of some genes, we must take into account something that we can measure. For example, 25 years ago was not known the mechanism underlying the oxidative stress. How a cell reacts, for example, to all these stimulus, heat. So if you have heat or a mechanical trauma, if I give you this, knock your face. If I give too strong, you can die. If I give small, nothing, but the correct make a reaction from your body. But each of these stressors, the stressor heat, the stressor traumatic, the stressor inflammation, the stressor ionizing radiation, and the same food like ozone, promote some biochemical pathway inside the cells. And like this, you can see we have one stress, something transducers inside the cells. These transducers inform a sensor and the transcription factor. The transcription factor go on the DNA and inform the DNA, look, there is something that is dangerous for us. That could be heat, could be traumatic, could be oxidative stress. But 25 years ago, we have only these letters, TF, sensor, without the possibility to know exactly which kind of. But the recent studies of Simmons explained to us the metabolic pathways of all this stress. And you can see the oxidative stress acts increasing the NRF2. NRF2 is something, transcription factor, that protects the cells against the oxidative stress. So our idea, our challenge was why we don't go to measure the NRF2 after ozone therapy. And now in the recent year you can read a lot of things. So this protein is a master regulator of the antioxidant response, modulating the expression of hundreds of genes, including not only the antioxidant enzymes like superoxide dismutases, catalases. So we know the Cuban scientists demonstrated that after ozone therapy at low doses, these enzymes increase. Now we know that probably they increase because NRF2 increase and activate the genes that produce the antioxidant. But not only. This Iberson, in molecular aspect of medicine, told to us and demonstrate that large numbers of genes that control disparate processes, such immune response, inflammatory response, tissue remodeling, fibrosis, carcinogenesis. So all the field, I finish, all the heterogeneous network of pathologies where ozone is active. We are going now really to give a name to this pathway. So I try a study, a clinical study in my clinic with only a few students, but we demonstrate that after autohemotherapy, the NRF2 increase, but it's very important that increase not only in the bottle, in the glass bottle when we put ozone and blood, but also in all the body. I told to these patients after half an hour, please stay here, that I want to catch your blood and to measure the level of NRF2 in all your blood. Incredible, does mean that the message of the oxidative stress was spread in all the body. Does mean that all the cells activate NRF2 and all the cells with NRF2 are protected by the oxidative stress. So, okay, we can understand why ozone could be helpful in all this. The pattern. Now I am writing a papers, and they will be on the journals in the next few months, where we explain a new approach. Because the pattern of the illnesses under the control of NRF2 are quite similar to those of ozone. And we need to start to study the effect of this gas, just looking to the body an integrated wall and not like a single organ. So if I give a medicine for the heart, I treat your heart, but I don't treat your body. If I give you some anti-inflammatory drugs, I treat inflammation, but not all your body. With ozone, we treat all your body. So our concept to study this must be modified, and will be reached immediately. I want to show you just some lipoma, a few slides of this with a small ozone injection. You can see this man before and after. Now after 10 years, 12 years is the same without doing any more ozone therapy. This is another on the air. This is herpes, ulcer. This is one case that I published on a journal of case report international, because the results was incredible. This woman went to my clinic. One colleague called me, Lamberto, look, if you can do, I try to do ozone therapy. So, and after the first treatment, this was the result. So here we are in the field of dermatology. So neurology, dermatology, and so on. This is acne, before and after. You can see the difference. It's wonderful, really. So final comment, we believe that really ozone therapy is not the whole, is not just so big, but could be a very important ally to all our. And I want to show you this article, just the first Mondial War. This Stoker, in 1916, he published on the Lancet. We have now we find a lot of good results with ozone. I mean, 100 of years ago, 1 century ago, what we did now. He told us that time that this could be okay. You know, because it's not possible to go to the pharmacy to ask, I want to buy 1 kilo of ozone. It's not possible. Ozone must be produced. So no marketing, no interest. for this. But we know that we can go far if we start with the right way to study ozone therapy. Thank you for your attention. Sorry for...